Uh, Welcome back. This is Gateway 101. We're having a little bit of technical difficulty, but we'll come in. Okay, welcome back. This is Gateway 101. In today's video, we're going to be talking about diabetes. We'll be talking about diabetics. Okay, part two. So we've talked about diabetes before. I will have some simple home remedy for diabetes. And do not forget that in Gateway 101 will places more emphasis on prevention because we strongly believe that prevention is better than cure. Okay, so in today's live broadcast, we're going to be talking about diabetics part two. I will say that diabetes is a long-term chronic condition that affects how your body control blood sugar, glucose, which is the main source of energy for your cell. Normally, your body uses hormone called insulin made by the pancreas to move glucose from the blood into cells. So diabetics happen when insulin does not work properly or is not made in enough quantity, causing blood sugar level to become too high. So we're going to be looking at about types of diabetes and their causes. So like type 1 diabetes, what happened? The immune system mistakenly attacked the insulin producing cell in the pancreas. So in type 1 diabetics, the, the immune system is compromised. In type 1 diabetics, it's an autoimmune reaction. Okay, because the immune system mistakenly attacked the insulin producing cell in the pancreas. So it is caused by autoimmune reaction. So type 1 diabetes is not caused by lifestyle. Okay, it is caused by autoimmune reaction. So result, little or no insulin is produced in the pancreas. So common age often started in childhood or young adulthood. So if you're in type 1 diabetes, you will require lifelong insulin therapy. Okay, so why in type 2 diabetics, which is the most common, what happens is that the body becomes resistant to insulin. Okay, in type 1, it's an autoimmune, okay, reaction. But in type 2, the body becomes resistant to insulin, or the pancreas does not make enough insulin. Okay, so these are two different things. So the cause of type 2 diabetes is the most common diabetes. Okay, and the causes of type 2 diabetes will include overweight or obesity. Overweight or obesity is one of the major causes of type 2 diabetes. Physical inactivities, if you don't engage in physical activity, it can also be a contributing factor. Okay, so it's also become a contributing factor to type 2 diabetes. Unhealthy diet, you eat too much sugar, you eat too much refined carbs, you eat too much processed food. Unhealthy diet can also cause type 2 diabetes. Family history, genetics, that is, great parents have it, grandparents have it, parents have it, then it's not come down on your lineage. So, family history, genetics, can also cause type 2 diabetes. Aging can also cause type 2 diabetes, mostly from the age of 40. Yeah, if you don't engage in vigorous exercise and also watch your diet, you don't eat healthy diet, and you put on too much weight, this can be a contributing factor of type 2 diabetes. Common age usually adult for type 2 diabetes, but now increasingly seen in younger people. Normally, is people are older adults that actually have type 2 diabetes, but it is now commonly seen in younger adults because of lifestyle. Okay. So, can often be managed. Type 2 diabetes can often be managed with lifestyle changes, oral medication, and sometimes insulin administration. Okay. So, gestational diabetes is another type of diabetes. Remember, we have type 1 diabetes, type 2 diabetes, and we have gestational diabetes. Gestational diabetes happen when high blood sugar develop during pregnancy. So the causes may be pregnancy hormone interfere with insulin function. So the risk factor is this: being overweight might be a contributing factor for gestational diabetes. Family history of diabetes might be a contributing factor for gestational diabetes. Previous gestational diabetes, that is, you had it before in your previous pregnancy, so usually goes away after childbirth, but increasing future risks of type 2 diabetes. So if after delivering, it's expected that type 2 gestational diabetes should go away after delivery, but it increases your future risks of getting type 2 diabetes. So, other less common causes of diabetes, genetic disorder affecting insulin production. So, genetic disorder affecting insulin production will be a less cause of diabetes. Disease of the pancreas. So, the insulin is made in the pancreas, so disease on the pancreas can also cause diabetes. Certain medication, e.g., long-term use of steroid medication, can also cause diabetes. Hormonal disorder can also cause diabetes. Why diabetes is serious? If not controlled, diabetes can damage the heart and blood vessels. Okay, so if not controlled, diabetes can damage the heart and blood vessels. Okay, it can also, if not controlled, diabetes can also damage your kidney. If not controlled, diabetes can also cause you blindness. If your diabetes is not controlled, it might lead to numbness or pain, nervous pain. It can also affect your feet, slow healing and infection. You heard that before. If you're diabetic and your diabetes is not properly controlled, it slow down your healing if you had a wound, and also slow down the healing process. Okay, so what are the common symptoms of diabetics? We're going to be looking at the common symptoms of diabetics. Frequent urination, number one, is one of the common symptoms of diabetes. Frequent urination. Excessive taste, you keep drinking fluid. Keep drinking fluid is a common symptom of diabetes. Extreme hunger, you eat, after a while you feel hungry again. It's a common symptom of diabetes. Unexplained weight loss, you eat a lot, you're feeling hungry, urinating, losing weight as if you're not eating. These are common symptoms of diabetes. Fatigue, feel tired for a very little exercise or a little activity, become so tired. These are common symptoms of diabetes. Okay, blurry vision is also a common symptom of diabetes. Slow healing wound. We had a wound that is not healing. Those are common symptoms of diabetes. Okay, so for the sake of you who are just joining us, we go to recap again. Okay, we go to recap again so that everybody will be on board. So what we are saying is diabetes is a long-term chronic condition that affect how your body control blood sugar, glucose, okay, which is the main source of energy for your cells. We also said that normally your body uses a hormone called insulin made by the pancreas to move glucose from the blood into the cells. So diabetes happens when insulin does not work properly or is not made in enough quantity, causing blood sugar level to become too high. Okay, so we'll talk about type of diabetes. I would say type 1 diabetes. What happens is the immune system mistakenly attacks the insulin producing cell in the pancreas. And we also said that autoimmune reaction not caused by lifestyle. It is an autoimmune reaction and it is not caused by your lifestyle in type 1 diabetes. So little or no insulin is produced. So often started in childhood or young adult. So you require a long insulin therapy. So if you are a type 1 diabetes, you will require insulin long therapy. Okay, that is you throughout your lifetime you will be on insulin. Okay, while in type 2 diabetes, which is the most common, what we say that the body becomes resistant to insulin or the pancreas does not make enough insulin. We also said that the cause will include overweight or obesity might be a contributing factor. We also said that physical inactivity can also be a contributing factor to type 2 diabetics. Unhealthy diet, you eating too much sugary food, drinking too much sugary juice, eating refined carbs. This unhealthy diet is also a contributing factor to type 2 diabetics. So family history, your grandpa was a diabetic patient, great grandparents are diabetics, your parents are diabetics, is now follow your family lineage. So family history, genetic can also be a contributing factor to type 2 diabetics. We also say that aging, usually adult, but now increasingly seen in younger people because of sugary juice, sugary food, refined carbs. So it can often be managed. Type 2 diabetes can often be managed with lifestyle changes, oral medication, and sometimes insulin. We also talk about gestational diabetes, and we said that in gestational diabetes, high blood sugar developed during pregnancy. It causes maybe pregnancy hormone interfering with insulin production. So risk factor will be you being overweight, you have a family history, you have previously gestational diabetes. In other words, in your former pregnancy, you have a gestational diabetes. So increasing the risk. It usually goes away after childbirth. Okay, but increasing the future risk of type 2 diabetes. So this is what I want to pay attention to if you're having a gestational diabetes. It will usually goes away after you have your baby, but it increasing the future risk of type 2 diabetes. So you have to pay attention to your lifestyle if you have a gestational diabetes. Okay. So we'll also talk about some less common causes of diabetes. I would say that genetic disorder affecting insulin production, disease of the pancreas can also be a contributing factor. I will say that certain medication, e.g., long-term use of steroid, might also lead to diabetes. hormone disorder can also lead to diabetes. So why is diabetes serious? We say that if not controlled, diabetes can damage your heart, it can damage your blood vessels, damage your kidney. Diabetes can cause you blindness, it can lead to numbness or pain, it can actually affect your feet, slow healing, and infections. So we'll also talk about the common symptom of diabetes. I will say that the number one symptom of diabetes would be frequent urination. You pee a lot. Another symptom would be excessive taste, extreme hunger. You drink a lot of fluid, but you still feel like drinking more. You eat a lot, you become frequently too hungry. Unexplained weight loss can also be another factor. You eat a lot, but it's like you're not eating, you're losing weight every day. Fatigue, you get tired even with little activity or little exercise. It can also give you a common symptom of diabetes will be body eviction. Okay, it can also give you body eviction. Then slow healing wound is another common symptom of diabetes. Okay, so let's look, but the good news is that diabetes can be managed. Okay, with lifestyle change or with medication. Okay, so let's look at diabetes management. Let's look at diabetes management. Um, let's look at diabetes management. Okay, so let's see. We say that practical explanation of diabetes management in daily life with a simple diet plan you can actually follow. So type 2 diabetes can be managed, it's manageable. So daily lifetime management of diabetes. Diabetes management is about keeping blood sugar within a healthy range every day. The goal is to keep a healthy blood sugar level within range every day. This involves food, activity, medication, and habit. Okay? Daily routine basic. We say that eat at regular time. Don't skip meal. Monitor your blood sugar if advised by your doctor. Okay, if you're diabetes, we strongly encourage you to make sure you monitor your blood sugar daily. Okay, depends on what your physician recommended. Okay, take medication or insulin as prescribed. Stay active, even light movement helps. So if you're a diabetic patient, I wouldn't encourage you to do a vigorous exercise. You have to do a light exercise of 30 minutes a day and 150 minutes a week would be ideal. Okay, don't engage in acrobatic or physical intense exercise. Don't do that. If you're a diabetic patient, stay active even if light movement. It helps. Okay, sleep well, at least sleep 7 to 9 hours, and try to manage stress. Stress raises blood sugar. Okay, diet principle for diabetes: you don't need special food, just balanced meal. Okay, the plate method, easy and effective. So at each meal, take half plate, not starchy vegetable such as spinach, cabbage, broccoli, carrot, tomato. Half plate lean protein, fish, chicken, egg, beans, tofu. Half plate healthy carbon, brown rice, whole wheat, sweet potato. Okay, a small amount of healthy fat such as olive oil, avocado oil, and nut. Food to eat more often. So we encourage you to eat. The best choice will be carbohydrates. Choose whole, slow digesting food, brown rice, oatmeal, whole wheat bread, sweet potato, beans, lentils. For your protein, we encourage you to eat fish, chicken without skin. Eat egg, beans, peas, soya beans. Okay, for vegetable, we encourage you, very important, we encourage you to eat green leaf, cabbage, okra, green beans, tomatoes, onions, and pepper. For fruit, we encourage you to be in moderation. Eat apple in moderation, berry, because this food contain a lot of natural sugar, like your apple, your berry, your orange, peels. So one portion at a time, not juice now. Okay? Fat, small amount, olive oil, nuts, seeds, avocados. Food to limit or to avoid if you are diabetic. Limit or avoid sugary food. We talked about that before. Sugary food and drinks. Soda, juice, fruit juice, candy, cake. These are contribute factors to diabetes. So you want to limit the intake of soda, fruit juice, candy, cake. Refined carb. You want to avoid refined carbs. White bread, white rice, pastry, fine and fatty food, deep fried snacks, fast food, large portion. Every healthy food can reduce your blood sugar if eaten too much. Okay, simple daily diet plan. So according to for your breakfast, we encourage you to take oatmeal with nut and some boiled egg, or you can take a whole wheat bread, egg, and vegetable for your breakfast. So your snack also will be fruit, apple, or oranges, and a handful of nuts. So for your lunch, you take brown rice or sweet potato. Also take grain, fish, or beans, large serving of vegetable. So your snacks will be yogurt, unsweetened, or carrot, or cucumber. Okay? Dinner, we encourage you to take smaller portion of carb, protein, fish, chicken, beans, and plenty of vegetable. So your drink will be water, unsweet tea. Avoid sugary drinks. So physical activity, we encourage you to be very, very important. We encourage you to do at least 30 minutes most day. Walking, dancing, climbing. Okay? Homework, walking, dancing, cycling, homework. And even 10 minutes after meal help lower blood sugar. So another daily tip will be check your feet daily. Diabetes can affect circulation, so I check your feet daily. Also, don't smoke. Don't smoke. Okay, those are daily tips. And also limit alcohol intake. Keep regular sugar check up. Okay. So key takeaway here will be diabetes can be well controlled with smart food choice, regular activity, consistent medication, healthy diet. Okay, it will be good. This will be very good to adhere to. Okay, make sure you eat smart food. Make sure you exercise regularly, and make sure you're consistent with your medication and daily health management. Okay, so let's look at the overview. Let's look at the overview. Look at the overview. Look at some diabetics management tip. Okay, we say that everyday diabetes management tip to help you live a healthier life, more balanced diet, more balanced life. I mean to say this apply to both type 1 and type 2 diabetes with small adjustment based on your doctor advice. So we say eat smart, not less. I also said that you don't need to starve, you need balance. Okay? We also said that you focus on whole grain, such as brown rice, oatmeal, whole wheat bread, lean protein, such as fish, chicken, beans, eggs, plenty of vegetables, especially leaf, green, healthy fat. We also say that you can use avocados oil, olive oil, or not. Yeah. Limit sugary drink and snacks. White bread, pastry, or processed food should be limited. Okay, large portion of starchy food should also be limited on rice, yam, and pasta. Also, we also say that use the plate method that, to guide you when you are eating. So eat at regular time. Skipping meal can cause blood sugar. Yeah, skipping meal can cause blood sugar swing. So try to eat meal and snacks at the same time daily. Don't skip breakfast if you're a diabetes patient. Stay physically active. Exercise help lower blood sugar. Usually aim for 30 minutes of walking, cycling, or swimming most days. Light street training, 2 to 3 minutes per week. Okay, so monitor your blood sugar, which is very, very important. We have some home remedy on how to monitor your blood sugar. So check that out on our YouTube channel. Check your blood sugar as recommended by your healthcare provider. Keep single log of reading, meal, and activity. Learn what food or habit rise or lower your blood sugar. Yeah. It also said that you should take your medication, take your insulin or your oral medication on time. You should be constant and persistent with your medication. Okay. We also talk about prioritized sleep and management. Okay. Aim for 7 to 9 hours sleep. Practice stress relief techniques. Keep breathing, prayer, meditation, or light stretching. Chronic stress can raise your blood sugar. We said that several times. He also said that stay hydrated, drink plenty of water, avoid soda, avoid sweet juice and energy drink. Okay, we also said that smoking and late alcohol and unlimited alcohol. So avoid smoking. Avoid smoking and limit alcohol. Possibly do away with alcohol. So smoking increases diabetes complication. Alcohol can cause dangerous blood sugar drop. Drinking only if approved by your doctor. Take care of your body. Check your feet daily for cut or sore. Maintain good oral hygiene. Get regular checkup for your eyes, your kidney, and your blood pressure. And also stay consistent. No perfect diabetes management is about daily habit. So not perfection, but daily habit. Small consistent shots lead to a big healthy food over management. Over time, Okay, so for those of you who are watching us or just coming in, this is Gateway 101. Okay, we'll place emphasis on healthcare awareness. We'll teaches you some simple home remedy. Like diabetes, we have a simple home remedy for diabetes on how to check your sugar and what you need to do at home. So please kindly watch that. Okay, that will go a long way to help you out a lot. This is Gateway 101. Thank you once again for watching and God bless. Thank you.